Today, we will explain to you how to differentiate between chest fat and gynecomastia. Hello, I'm Dr. Sheetal Londhe. I'm board certified plastic surgeon practicing at Zero Size, Viman Nagar, Pune. When you see both may look like same, yes, you can say, ma'am, I don't have any gynecomastia, but it's just the fat. Or you can even have the reverse. But let us come to the main differences that they have. Gynecomastia is because of abnormality of the hormones. Okay, there is a different surge between the estrogen and testosterone. The gland gets stimulated, and so the gynecomastia appears along with the fat deposition around it. Okay, if a patient is lean and he has breast tissue or he has puffiness under the nipple, then it is gynecomastia, because you can't be lean all over and have only fat around the breast area. So that's gynecomastia. But a patient is very obese and he has even heavy breast. So then we need to differentiate, is there a component of gynecomastia in that, or it is only the fat that is present. So there are a few tests that we run, or clinical examination which will tell us. But yes, you want to do it for yourself and get clear whether you have fat or you have gynecomastia. Then we'll just give you some cliche points which will help you to differentiate that. So first, gynecomastia has got breast tissue. So when you feel it with your fingers, it's always firm, rubbery and dense. Whereas when you see the fat, it's very squishy and jelly-like. So that's the first difference. Second, if you see gynecomastia patients, they're not very obese usually. They are lean, and that area, give you results for your dieting, for your exercises. So when you lose weight from all over, the fat will also come down, but gynecomastia will never come down. Third, yes, gynecomastia is breast tissue. So when it is in more grades, you will have the shape of a breast. It will just not be like how the fat is deposited from up to down. It will simulate like a breast tissue. And according to the grades, like grade 1, 2, 3, which we've already discussed in our prior videos, you will get to know, yes, it is a gynecomastia and not just fat. Whereas if the patient is having, you may feel, mujhe grade 4 gynecomastia. But yes, if you have lots of fat which is deposited all over, it is going to your posteriors also, then yes, that is fat. Again, one more point is, when you have gynecomastia, it can be tender to feel. When you press it for a long time, it may be tender, you may have pain in that. Whereas in fat, if you squeeze it, there's not going to be any pain. So this is also one differentiating point. In these patients, it's difficult to differentiate ki andar gynecomastia hai ya nahi only by palpation, because the fat is so much. Then we may require some tests like sonography to differentiate. So now we have seen by texture, that is by feel, you can differentiate between fat and the gland. Second thing, by the shape, fat will be all over. Gynecomastia will have a shape of a breast tissue. Third, we have also seen if you do exercise and dieting, gynecomastia will remain, but the fat will go away. So these are the main differences that are there. If you have any issues regarding, do I have gynecomastia or do I have only fat deposition? Yes, I do exercise and I lose something and then it doesn't go and all. Then please take an expert opinion from a plastic surgeon. Get yourself evaluated. You have any doubts, feel free. Come, visit us at Zero Size, Viman Nagar, Pune.